Hello and welcome back. I am Dr. Ankit Gupta and this is the second part of the video on blepharoplasty. If you have missed the first part, there is a link given above on which you can click and see, on which I have described who is a right candidate for lower eyelid blepharoplasty and what things can be achieved and what cannot be achieved and what we do in this surgery. In this video, I, Dr. Ankit Gupta, will explain you about what things we need to do just before the surgery, that is the blood tests, and how the surgery is carried out and what things you need to take care of after the surgery. Friends, my name is Dr. Ankit Gupta. I am a plastic surgeon and I practice at Pitampura at Panache Hair, Laser and Plastic Surgery Center. So in the last video, we explained you all about before the surgery. What we've missed was what are the blood tests that you need to do. After you have seen me or any other plastic surgeon, they would advise you to undergo a few investigations to rule out any cardiac, any liver or kidney issues. Plus, they would evaluate you for any other comorbidities that you suffer from. They would check your blood pressure. They would want to see your complete blood counts to see your platelets and your hemoglobin or your WBCs. They would want to see your kidney function, liver function, your blood sugars levels, maybe your 3-monthly HbA1c, your thyroid profile, your viral markers like HIV, hepatitis B and C, your bleeding markers like PT, APTT and INR. They would take a detailed history if you are on any kind of blood thinners, any kind of medications like multivitamins, green tea, fish oil, omega-3 fatty acids. Also, if you have any addiction to smoking, because smoking can cause a lot of delay in your healing process. They would want to know about your lifestyle. What is your job? Do you have a sedentary lifestyle or a very hectic lifestyle? Because once the surgery is done, you will not be allowed to do a lot of heavy work for about a month. The bruising and everything would be there for at least a week and can be there for up to 2 weeks for those who are fair skinned. And if you are combining multiple surgeries like blepharoplasty and fat grafting plus nanofat with microneedling, the bruising can be for a little bit longer period of time. If you are of age more than 40-50, then the bruising is slightly more in a bit older or bit mature people compared to the younger generation, and it also depends on how much you bruise. So on the day of surgery, if it is under general anesthesia, we would want you to be 6 hours nil per mouth, that is no water or food 6 hours before the surgery. For local anesthesia, it can be only 2 hours. We would want you to come here at least 2 hours before the surgical time so that we can prep you, again check all your investigations, do your blood pressure measurements and make you comfortable, do all your file work, take your pictures, discuss everything again as to what is your requirement and discuss the surgical plan again. Do all the markings, take your pictures, and once we have explained you everything, the surgery starts. Usually the blepharoplasty surgery would last anywhere between 45 minutes to 1 hour. And if you are combining multiple surgeries, it can go from up to 1.5 to 2 hours. Usually we do combine blepharoplasty with fat grafting and microneedling or maybe laser treatments. Sometimes we also combine it with upper eyelid blepharoplasty. Then it can take up to 2.5 hours. Once the surgery is done, you are supposed to be lying with slight elevation of your head. We advise you to apply ice packs for at least 2 days. Every hourly you need to apply the ice pack for at least 15 minutes, which will reduce the swelling and the bruising in the periorbital area. Plus, you will be advised to take antibiotics, painkillers and antacids for at least 1 week. You should not be doing a lot of heavy work for initial 1 week. And after that, you can do a little bit of weightlifting and everything, but a lot of heavy work needs to be avoided for at least 1 month. I advise you to join back work if you are doing work from home, maybe from the day 2 itself. But you will have a little bit of irritation inside your eyes because the stitches are there inside your eyes, which causes a little bit of rubbing and irritation and lot of watering. And you need to be maybe off the screens for about 2 to 4 days and then you are much more comfortable. It's not like you're not allowed to watch your phone or television. There's a lot of discomfort while you do that. So maybe if you have to go to work, 7 to 10 days leave would be sufficient for the bruising to subside. If you are okay with applying makeup on your face, then maybe 7 days is sufficient. So the things that you need to take care of in the post-op recovery period is that you sleep with your head in elevation. That is, keep 2 pillows under your head, drink a lot of fluids, maintain your hydration, use a lot of ice packs to reduce the swelling. If possible, use arnica creams or arnica tablets, which are homeopathy tablets, to reduce your bruising. Have somebody with you or have some help, because in the post-operative period, at least for 1 day, you feel a lot of discomfort. If you were under general anesthesia, you need to be there in the hospital for at least 4 to 6 hours after the surgery. But under local anesthesia, you can travel back after 1 to 2 hours. So make sure that you have somebody to drive you home. You will be taking antibiotics, painkiller, antacid. So all those things, if you want to take care of before, you can buy them before. And the bruising and everything will take at least 1 week, and heavy activity for 1 month. You need to avoid that. Now the most important thing, when will you see the results? So you see your eye bags gone immediately on table, but then the swelling starts to appear, and within a week almost 70 or to 80% of your swelling is disappeared, and almost 90% to 95% goes away within a month. You look your best at about 1 month, but the swelling would still go away, still reduce for up to 3 months, and the fat, if we have filled that, would reduce for up to 3 months. And at 3 to 6 months is the final time when you see the actual results, which will be there for a very long period of time. These results are almost permanent, but yes, you cannot prevent aging. So whatever changes you see is because of the further aging that you will develop during the coming years. But if you don't age, if you stop aging, if there is a magical way of you stopping your aging process, then you will remain like this for your life. So finally, how should you choose your plastic surgeon who will be operating on you? So first of all, you need to make sure that he is a well qualified person. He has done his MCH or DNB in plastic surgery. Second, he does a lot of aesthetic work and is not a reconstructive surgeon per se, because as you know, even in plastic surgery there are 6 different branches. One is burns, one is craniofacial, one is reconstruction, one is aesthetic surgery, then there is hand surgery, and so on and forth. So make sure that your plastic surgeon is well versed and does a lot of cases on aesthetic surgery, especially around the periorbital area, so that he has a fair bit of experience of doing blepharoplasty surgeries. You should look for their before and after pictures and ask for a proper consultation. Once you are done with the consultation, you will be able to make out if the person you are talking to makes sense or not, and if that person vibes with you and you are able to understand, then you should choose that person for your blepharoplasty surgery. So friends, if you combine the both videos, that is the part 1 and the part 2, I hope I was able to answer to most of your queries. If you still have other doubts, you can always talk to us or write to us. I'll try to make more videos on blepharoplasty surgery to answer all your queries on blepharoplasty. Thank you and have a nice day.